That coronavirus spares the very young is one of the rare reliefs this pandemic provides, but it isn't so sparing of those that care for them.
I'm going to check your temperature. Remember, ready?
While COVID cases among children remains extremely low, for nursery staff, rates are rising fast, with support to keep them safe slow in coming. This nursery in Kent has received no COVID tests, no PPE, no extra financial help, despite being told by the government to stay open to all children.
We've been told it's safe, but that's a lie. Because categorically people are getting ill and people are going to hospital. So for us, we feel a little bit like, one, we've been forgotten, and two, we've been lied to.
COVID outbreaks among staff here have forced the nursery to close 3 times. Carolyn has 2 sons. One is shielding, the other has special educational needs, but she spends the days looking after other people's.
Most of us are scared. I've definitely had my moments where I've just sat in bed and cried, but I also know all the girls have. And being someone that you've got to be a motivator as well for children. You've got to motivate these children, you've got to motivate the parents and show them that we're safe and we're happy to have them back. But at the same time, you feel conflicted to be here yourself.
We've got these tests. They're a rapid flow test.
You bought those yourself?
We bought these ourselves.
Jo is doing her best to keep her staff safe. But unlike schools, as a privately run nursery, they do not have access to the government's testing programme. Given you're open and the government have told you to be open, would you expect the government to provide some tests for you?
We would definitely expect them to provide in-house testing.
And charitable nurseries face the same problem. This East London nursery is struggling to stay open. They've had 3 members of staff hospitalised with COVID since last Friday. Those that remain accept the risks of looking after these children.
Are you going to let a child keep crying? You have to hug the child. So in that case, there's no social distancing.
But they cannot accept those risks not being recognised.
We must have tests to continue to be able to provide this service. Every day is a challenge, and that challenge will only increase. We must not be forgotten and absolutely considered for frequent testing and a vaccination.
The government says it's vital that early years settings stay open and insists children are unlikely to play a driving role in COVID transmission. But as staff sickness rises, so too does the fear and the frustration that their stories are not being heard. Daniel Hewitt, News at 10.